It's obvious that the growing surge of coronavirus cases in LA is impacting hospitals, but it's affecting emergency services as well. Hospitals are slammed with a critical level of patients, and now EMS units are being told not to transport those with a low chance of survival.
COVID exposed the fatal flaws of the American healthcare system. The world's richest country is leaving tens of millions without protection against diseases, making them more likely to die, sicker and younger. When the healthcare spendings of the top 11 countries were compared with the healthcare system's performance, the US fell far behind the other 10 countries, with the lowest healthcare system performance and highest healthcare spending as a percentage of GDP. The push for universal coverage in America began in 1945. A new bill was introduced by President Harry Truman. Based on President Franklin Roosevelt's platform in the mid-1930s, the bill proposed the idea of codifying universal health care for the middle and lower income classes. However beneficial this plan may be, Congress swiftly shut it down, branding it as socialist. There have been attempts to rekindle this notion of universal health care, a current example being Obamacare, which covers 35 million people. The American Medical Association replaced the rejected plan of universal health care with a combination of private insurance and various federal and state programs, leading to the plan America has today, least effective among other countries in America's wealth class. So how is healthcare in countries measured? The ranking of healthcare is based on quality, efficiency, and life expectancy, with a focus on cost, equity, and access to care. American healthcare is expensive, more so than any other developed nation. Not only is the coverage itself expensive, the drugs themselves often cost much more than the same drug in a different country. Dr. Maria Redondo is an endocrinologist at the Texas Hospital. She works with children with type 1 diabetes and shares her point of view of the American healthcare system.
Definitely, there's a lot of problems. We need to make it more affordable. We need to learn what are the best ways of treating insulin for most people, for different groups of people. Basically, there's a lot of work to be done.
The healthcare system is beset with inequalities, not only within the income classes, but also in people of color and other marginalized groups. These inequalities widen the disparity in health insurance coverage, access to services, and health outcomes between income classes and certain populations. Out of the other high-income countries, the US remains to be the only country without universal health care. For example, in Canada, the universal healthcare policy alleviates the cost and provides better healthcare simultaneously. Canada's healthcare system is income-based and funded through taxes, as opposed to America, where all pay the same for the same services. This puts pressure on those who don't earn as much and contributes to a less effective healthcare system. Health Canada is responsible for helping Canadians maintain and improve their health. It ensures that high-quality health services are accessible and works to reduce health risks. The goal of the Canada Health Act is to discourage the development of a parallel private system and protect the integrity of their respective publicly funded healthcare systems by ensuring that access to insured physician and hospital services is based on medical need and not the ability to qualify and pay for insurance. So, what can you do? To begin, better the current American healthcare system by electing officials who care to either improve the quality of healthcare or create a universal healthcare system. Oppose health insurance plans in the small-scale markets that do not guarantee pre-existing condition protections, coverage of essential health benefits, and other protections against annual and lifetime limits. More specifically, we can vote for officials that promote universal coverage, support organizations that push for an expansion of coverage in the American healthcare system, and lastly, apply to receive healthcare, if or when you meet age requirements. Those who lack healthcare coverage die sicker and younger. The introduction of universal healthcare paved a path. From Roosevelt in the mid-1930s, to Truman in 1945, to the recent Affordable Care Act, we need to continue on this path for comprehensive and affordable universal coverage for all Americans. 30 million people are counting on us.